Hospitalizations have dropped by a third over the last 7 days, and PCR positive tests have decreased by 16% over the last week as well. In terms of vaccinations, we now have over 53% of Georgians over the age of 12 fully vaccinated and over 64% with at least one dose. Before I turn it over to Dr. Toomey to cover some information on boosters, I want to mention monoclonal antibody treatments and the recent changes of the distribution model. About a month ago, the federal government completely changed the allocation process. Previously, providers were ordered directly from the distributor. Now the state is given a weekly allocation and must determine where the treatment doses go based on utilization and reporting. In short, we're being capped on our allocation. A few weeks ago, we were allocated over 10,000 doses. Last week, we were allocated roughly 8,200 total antibody courses that the state sent to 84 different providers. For the coming week, our allocation is now down to 7,890. We will continue to distribute these treatments as quickly as we have provided them and urge anyone who tests positive and is vulnerable to severe effects of COVID-19 to utilize this resource. However, monoclonal antibody treatments are secondary to getting vaccinated. Our 3 safe, effective vaccines remain the best tools we have to slow the spread of COVID-19 and to prevent hospitalizations and death. Today, I want to emphasize the importance of not waiting until the next wave of COVID cases to get vaccinated. During our summer surge, many Georgians saw firsthand how the Delta variant spread more quickly and still led to the deaths of our fellow citizens. Given that our increase in cases and hospitalizations in 2021 were similar in timing to surges seen in 2020, we can only assume that a winter increase is also possible. I'm encouraging those who are unvaccinated to talk with your doctor or a trusted medical professional about getting vaccinated before whatever may come our way later this year or in early 2022. I'd also like to thank all the state employees who took advantage of the extra day off of work on September 3rd to get vaccinated. 20,000 Georgians rolled up their sleeves that day, which is the highest total for the entire month of September. In closing, I'd like to thank our healthcare heroes for their work over the last couple of months to provide high-quality care to Georgians across the state, as well as our public health workforce, our National Guard, troops, and many others who have helped us get through this last surge. Just a lot of great work at a very difficult time, and we continue to say thank you to all those who have been in the fight. As you know, these Georgians have worked tirelessly in tough conditions, and we could not be more grateful. With that, I'm going to turn it over to Dr. Toomey for her update. Doc?
Thanks so much. Certainly the pattern we're seeing now epidemiologically is a welcome one, and really not unlike what other countries have seen with the sharp increase and sharp decline in Delta, and we have to maintain our vigilance as we continue to monitor the variant spread throughout Georgia and the rest of the country. But I wanted to focus today on the booster doses because I believe there probably is some confusion about who exactly is eligible and how you get them, because there are many different messages that came out of the federal government, the FDA, ACIP, CDC. First of all, CDC made several recommendations for booster doses, and which is different than the third dose that's been recommended for those who are immunocompromised. And that's important. Anyone who is eligible, regardless of the vaccine type you got, was eligible for this third dose. But the booster is designed to address what may be waning immunity, particularly seen in older individuals who have a less robust immune system. The need for a booster right now isn't an emergency. This isn't that we all have to run out and hurry up and get our boosters. And that urgency that we felt a year ago, so many of us felt, is not what this is about. It's about ensuring we still have a strong immune response for those who have been vaccinated. We still, all of us who are vaccinated, still get good protection from severe illness and hospitalization with our current vaccinations. And we have plenty of vaccine now, which is a different situation than when we first rolled out the vaccination program a year ago. But given the concerns of a possible decreased immune response, CDC thought it was important to boost our community immunity among those vaccinated. There are a few caveats. Right now, these boosters are just for people who have received Pfizer. And I know that's really of concern to people who have received J&J or who have received Moderna. That will be coming. We anticipate from CDC that the recommendations for boosters for the other vaccines will be coming in the coming weeks very quickly because they are examining the data for those vaccinations. But it's just for those individuals who receive Pfizer. And remember that your current vaccinations are still offering significant protection. And no one is authorized at this time to boost with Moderna or Pfizer. First boosters are not mandatory. That's the other thing. I think people are saying, do I have to do this? Am I still going to be considered fully vaccinated? You and your physician can make the decision as to whether you will benefit, but the definition of fully vaccinated remains 2 doses of Pfizer. So again, another important thing to bear in mind because I know it's caused some confusion. CDC outlined categories of who are eligible for boosters, but I'm going to simplify the categories to make them a little easier to understand and actually, in a sense, plagiarized Dr. Walensky on a recent call because she made it much clearer and kind of collapsed some of the categories. First and foremost, older individuals, 65 and older, and any individual in long-term care facilities, regardless of age, should receive their 3rd shots and are working with we are working with the long-term care facilities actively now. But in her discussion, Dr. Walensky suggested that a way to think about this is anyone 18 and older, so 18 to 64, with underlying medical conditions that may put them at risk for complications should also, it can also be eligible. And so we know what those conditions are. We've seen this before. Probably older individuals are at higher risk than the younger ones, but still, 18 to and older, if you have any underlying condition that may put you at higher risk for complications, obesity, diabetes, heart disease, chronic lung disease, severe asthma, dementia, really any chronic health condition that may impair your ability to fight off COVID infection, and you're 18 and older, you can receive the booster. Another high-risk condition, incidentally, is pregnancy, and CDC now is actively urging us to ensure that pregnant and recently pregnant patients get vaccinated or get boosters as they are more likely to become severely ill. And the last category that are now eligible and may get booster shots are individuals who have occupational exposures. And when you think about who has an occupational exposure, who are essential workers, that category is very, very large. It's everything from healthcare workers to teachers to anyone who works in a healthcare facility, cafeteria workers, the individuals working in our poultry plants, the people who keep our state running, from grocery store clerks to first responders to mailmen. I really see this broad category as encompassing most, if not all, previously vaccinated individuals, including their household contacts and caretakers, if they choose to get the booster. So when you put those categories together, one simple way to think about it is that the criteria for current boosters are simple. You've, number one, previously received a Pfizer, and you're over the age of 18. And I think that makes it easier. It's self-attestation. You can go to the vaccination site, whether it's a public health department or it's CVS, Walgreens, any of the many of our chain drugstores and pharmacies that we are working with. Make an appointment obviously is better, but many people are able to walk in now because we have plenty of vaccine. The sites with Pfizer availability right now are available on our website's Vaccine Finder. And in addition, we're actively working with primary care providers to encourage them to also offer these booster doses. We are repackaging Pfizer, as I mentioned before, into smaller packages so it's easier for them to manage. And we also have been giving webinars specifically for providers who may want to join into this vaccination campaign, and give them additional information how to register, but also which among their patients may be at highest risk. We just did one on Tuesday for women's health care providers that was excellent and is on our website. So the bottom line that I want to leave you with today is you don't need to run, but walk to get your booster. If you were over 18 and initially got a Pfizer more than 6 months ago, and if you are at risk, feel you're at risk or would like the booster, and talk to your doctor if you have any questions. For those with Moderna and Johnson & Johnson, it should be a short wait, and we'll let you know as soon as those approvals come through. But the most important message of all, the single most important thing we can do as a state is get additional people vaccinated for the first time. Our numbers of total vaccinated individuals is still too low, and most experts believe that our rates are not sufficient to combat any possible future surges that may come our way. So when you go to get your booster, take a friend, take a family member, take a neighbor who you know was a little hesitant about getting the vaccine. Have that friend, have your mother-in-law go with you who wasn't vaccinated. I think it's going to be these small acts of kindness and community engagement working together that will allow us to end this pandemic. Thank you.
All right, thank you, Dr. Toomey. We'll open it up for questions for either one of us.